Welcome to our sixth podcast of Talking Water Honestly. I want to thank our Executive Director and CEO of Louisville MSD, Mr. Tony Parrott, for the opportunity to execute his vision of gathering experts in the water sector to share their challenges, solutions, and lessons learned. My name is Zonetta English, Strategic Initiatives and Project Delivery Director. Also, I have the esteemed pleasure of being the Community of Practice Director for Resilience, which includes the utility management community of the Water Environment Federation. Talking Water Honestly's mission is to develop content to assist utilities across the U.S. to solve their water challenges and share their expertise. This investment will save our organizations critical resources and provide smaller utilities access to vital information. In addition, these conversations provide an avenue for our ratepayers to gain insight to the intricate and complicated issues we face in providing critical services to our communities and introduce you to an array of dedicated water professionals. Our topic of today's podcast is wastewater surveillance. Wastewater has been known to be the truth teller in public health for quite some time, an early system for diseases found in the waste of humans and animals. It provides an early detection tool that can help communities prepare for and take action to address increasing cases of infectious diseases prior to humans being symptomatic. Historically, wastewater utilities participated in research with universities and some private sector businesses with emergent contaminants of concern and opiates. However, when the COVID-19 pandemic occurred, we found how critical this tool was not just in the U.S., but around the world. Now that the pandemic has concluded, why is wastewater monitoring still important? We provide key data to assist public health officials to track influenza, measles, RSV, monkeypox, still COVID, and other infectious diseases. The Water Environment Federation understands the importance of wastewater surveillance. WEF President-elect Mr. Paul Schuler is leading efforts in international collaboration in wastewater surveillance and management. He was just in South Korea last week to discuss strategies for enhancing water infrastructure and collaborating on advanced wastewater technology. It will take our governmental agencies, local public health officials, private sector, and utilities to continue to protect our communities across the U.S. and the world. Again, I want to thank our panelists for agreeing to be a part of today's discussion. I turn it over to Mr. Jamie Gellner with Hazen & Sawyer, who will be the moderator for our panel today. Thank you.
Thank you, Zonetta. And again, thank you for everyone being here today. We're looking forward to our conversation today into wastewater surveillance. And again, just to talk a little bit more about obviously how it's been used, but also how it's continued to be such a good source of information and a truth teller, like you said, Zonetta. Again, I'm Jamie Decker. I'm with Hazen & Sawyer, also part of WEF's utility management community. And with us today, I just want to do some introductions of our guests today. So first, we have Dr. Rachel West with the Centers for Disease Control. She's part of the National Wastewater Surveillance System and a senior scientist with the CDC. We also have Dr. Rochelle Holm. Dr. Holm is an associate professor at the University of Louisville, part of the Christina Lee Brown Environment Institute and part of the School of Medicine there. We also have Jennings Heisner. Jennings is with BioBot and is their government partnership consultant. And has worked with a number of utilities as well as other industries around the country around wastewater surveillance. And last but not least, we have Scott Broski from Northeast Ohio Regional Sewer District. Scott, as the Superintendent of Environmental Services, has been a key part of their wastewater surveillance program. First of all, thank you all for being part of the Talking Water Honestly podcast today. Again, looking forward to this discussion. To start things off, for some of our audience that don't know much or haven't heard too much about wastewater surveillance, just thought we could talk a little bit just about what wastewater surveillance is and how that's being used. So Rachel, you may give maybe again with your work at the CDC just a little bit of background about what wastewater surveillance is and just also share a little bit about the National Wastewater Surveillance System.
Sure. Thanks so much. And thanks for having me today for this discussion. Wastewater surveillance is really just the monitoring for disease-causing germs or pathogens in untreated wastewater to understand community health. And so we've been doing this now for a few years, at least domestically, but it has a rich history through the decades in looking at public health and community health. So how it works is that an individual who has an infection can shed pieces of that pathogen, whether it's a virus or bacteria, when they're washing their hands, when they use the bathroom, when they shower. And those pieces of those pathogens enter the wastewater system, what some folks refer to as sewage. And when it enters that untreated wastewater, we can then sample it. And typically, wastewater is sampled at a treatment plant, but it can also be sampled at other locations like a manhole or other places upstream. And when that sample is taken, then it can be sent to a lab for testing. And what the lab does is it tests for those sort of signature pieces of that bacteria or virus and then measures those levels. Those data can then be sent to either the health department locally or state, and then it can be sent to CDC where we receive it, check it for quality, and analyze it. And so that's in a nutshell what wastewater surveillance is and how it comes into CDC. And as I mentioned, we've been doing it for a few years now, but we started with 8 early implementers, and now we're at over 1,500 sites, which covers about half of the US population. And we're really excited of how it's grown, not just to population coverage, but also to different pathogens. So we started as part of the COVID-19 pandemic, really focused on SARS-CoV-2. And then as emerging outbreaks came along, we were able to pivot and start including those pathogens as well. So now we have public data dashboards for things like SARS-CoV-2, Mpox, but also flu A and flu A H5, as well as measles and RSV. So that's a bit about how it has grown here. And nationally, we found it can be incredibly useful as an early warning system, but also just as an additional perspective on community health to understand, even if people aren't able to go to the doctor or don't know that they're sick, we can still get a nice idea of the pathogens that might be circulating in a community, in addition to that clinical and environmental surveillance that's so valuable to public health. So I'll stop there, but I'm happy to answer any questions.
Yeah, no, Rachel, it's amazing how much that has grown in just a short time period. And I think we're going to get into a lot of just how useful that information is. But that was a really good kind of overview of just how we're using wastewater surveillance, how we have been here too. Just want to turn a little bit again on the utility perspective. Zanetta, you want to share just a little bit about how Louisville MSD has, started doing wastewater surveillance, when that started, and how you guys have been using that information?
Well, yes, Jamie. We started testing because of the pandemic. We found it being critical supporting analytical method validation, as well as being on the forefront to assist with monitoring different variants. We wanted to be a partner in protecting public health as well as our employees. Louisville MSD was one of the initial utilities that participated in the BioBot testing program in April of 2020. We initially started with 3 treatment plants, testing them once per week, and then we eventually expanded to all our treatment facilities, which were 5 in Jefferson County. And we continue the program today. We continue to partner with the University of Louisville, BioBot, and then we also work with wastewater scans. So we've been doing it since 2020 and see the need to continue going forward.
Yeah, thanks, Zanetta. And I know that has been really helpful, not just for Louisville MSD, but for the city of Louisville and those areas. You mentioned BioBot, so I wanted Jennings just to maybe share a little bit about, again, what BioBot is, how you've come into working with wastewater surveillance, and kind of how you guys have helped, utilities and other groups.
Yeah, thanks, Jamie. So BioBot Analytics is a wastewater intelligence company. We were founded in 2017. We were spun out of doctoral research that one of our founders was doing at MIT. The company was originally focused on the opioid epidemic, helping communities across the country better understand the overdose problems that their communities might be having. But as Zanetta pointed out, in April of 2020, we found a way to refocus the company to look at infectious disease, specifically SARS-CoV-2, and stood up a pro bono program that served about 350 different utilities throughout the United States, giving them life-saving early information about the spread of SARS-CoV-2 throughout the country. From there, we've grown into a company that offers information on everything from measles and influenza to the presence of things like fentanyl and xylazine. We're a really holistic company looking at community level health through wastewater.
Thanks, Jennings. That's really impressive. You guys have been able to do that, and we're in the right spot in time to be able to really help with it during the pandemic in particular and transition with that.
Yeah, and we couldn't have really done it without people like Zonetta and the utilities around the country. I mean, they are kind of the backbone of this work, right? They're the ones who are providing us samples to do the analysis that give this life-saving information. Like Zonetta said, we have been working with them for just about 6 years now. And so we're really proud of the relationship we had with all of these utilities and, hope that they continue for a long time in the future.
I guess, Dr. Holm, you guys have also, obviously being in Louisville, you've, worked with MSD and with others as well. Share just again what that connection is with public health in particular, and just how you've been able to work with, the city of Louisville and other components of there as well.
Well, thank you. And first, I'd like to thank MSD for being so connected to our ratepayers and the broader community, and for really embracing the value of wastewater surveillance. At the University of Louisville, we currently lead sampling for SARS-CoV-2, flu, and RSV at 5 MSD water quality treatment centers. We do this twice a week through a partnership with the Kentucky Department for Public Health and the Louisville Metro Department of Public Health and Wellness. Samples are collected on Tuesdays and Wednesdays, and we send results to our local partners in a short email report each Friday. One thing that's really unique about this work is the broad group of stakeholders who receive and use our data. Of course, that includes MSD and public health partners, but also vector control, the local school district, and other researchers, as well as other interested groups in the community. And from my perspective, this partnership between Louisville MSD and the University of Louisville has really supported the health of our community, especially over the past 6 years.
That's great, Rochelle. And it's been a strong partnership between both University of Louisville and Louisville MSD and the city. That's been awesome to see how that's been used. We'll talk a little bit more about that too. But Scott, just also want to just touch on a little bit about how you at NUSD have been part of wastewater surveillance over the years, and how that's maybe changed over time as well.
Sure, and thank you for having me. Very early on in the pandemic, toward the end of March, early April, we got involved with wastewater surveillance, and that happened when the U.S. EPA's Office of Research and Development, which is in Ohio, started to reach out to stakeholders in the state to see if there would be an opportunity to partner and start exploring and using wastewater surveillance. And that was in conjunction with the CDC, and they reached out to Ohio EPA. Ohio EPA facilitated some discussion with AOMWA, which is the Association of Ohio Metropolitan Wastewater Agencies. And AOMWA engaged all of its membership and had some discussions, and we quickly were front of the line to say we want to participate. And so we very quickly started working with the US EPA, AOMWA, the Ohio Water Resources Center, ODH, and other stakeholders to plug in to become part of this. And so while the program was being established in Ohio, we were working out logistics. The state did not have a designated laboratory to do the analysis yet, so the state started partnering with research universities. Kent State was a university in our area that was identified to handle Northeast Ohio samples. And so by August of 2020, we were using our 24-hour composite influent sample that's collected daily, 3 wastewater treatment plants, and having that a fraction of that composite turned over to Kent State, who was doing the analysis and providing the data to the state. this has obviously evolved over time. The Ohio Department of Health has now moved all of the analysis into their in-house state laboratory. So all wastewater treatment organizations that are collecting samples are sending their samples to one common laboratory. So everything's on a common method. So we're not getting any intra-laboratory variation or anything like that. And we have a common picture across the state. We started looking at the methodology in our laboratory because we were equipped to do qPCR and genomic sequencing in our laboratory, but we recognized the need to be part of a uniform program and to not have, data that really align with, perfectly with the methodology being used elsewhere. So we elected not to bring that on in our own laboratory, but to take part in the state's program. And so August of 2020 through latest today, we've turned over samples and we continue to have our samples analyzed and our data posted, both the Ohio program on the COVID dashboards that were developed during the pandemic that still exist. And I believe all of our data is transferred to CDC as part of the National Wastewater Surveillance Program as well.
Scott, how often do you guys take samples for this, and how much effort is that on your staff?
Yeah, we have 3 wastewater treatment plants, and we sample twice a week. So our Sunday composite is picked up Monday morning, and our Tuesday composite is picked up Wednesday morning. So 6 samples a week is what we turn over to the state for analysis. And it's really very little effort on our part because we are sampling our influent with a 24-hour composite sampler already for our permit compliance. So the samples are already coming into the laboratory. So it's just a matter of fractioning off a separate portion into the containers that go off to the state laboratory. So very, very little extra effort is necessary on our part, which makes it so easy to participate.
Yeah, great to understand that, Scott, and a lot of what you're already doing, but be able to share that data as well. Again, I guess want to talk a little bit further and hear a little bit more of just how that data has really been used. And, a couple of you have mentioned about this going on to different dashboards and to disseminate that information out to the public. But, Rachel, from your standpoint, kind of a national perspective, how do you guys share that data out nationally, and how do people, get to know or know where to go for the National Wastewater Surveillance System?
We do collect data from a few different types of partners. So some public health labs, some private, some academic, some private commercial partners as well. And all of those data come in through our platform called OneCDP. And it used to be called Decipher for those of you who've been with us for quite a while. And that platform is a secure data platform that health departments can access. And they can access their data in real time. So that internal private dashboard is where our health departments go. It's where we go for response information. And that has the highest level of detail. And I do want to share that for jurisdictions who send data in, they're only able to download their own data. You can't download the data of another jurisdiction. And those data are also used to inform our public dashboards. So another way that we share the data are public dashboards, but that has some data suppression to try to preserve privacy and some considerations that certain communities might have. We also have a little bit more lag time so that we can check the data for quality. We can talk to the jurisdictions if we see something that comes up that seems a little bit different or maybe concerning, then we have time to talk to them and see what's going on, see how we can help. So our internal dashboard is real time. As soon as we have the data, the jurisdictions have the data. And then the public dashboard is how we share it with all of the community members so that they can have that timely information. And that's updated weekly. So I did hear a mention of several local dashboards because although we have our public dashboard and we have this internal dashboard, all of our jurisdictions are able to use their data to inform their own dashboards for their community's needs. So our dashboards that are the National Wastewater Program, they display things like measles and Mpox and influenza A. But there are some local dashboards that might want to display other pathogens that they're testing for that are important to their community. And that's a really nice flexibility of wastewater surveillance and the data that can come in. So those local dashboards are really exciting. And that's honestly where we've learned some innovation is from all of our local partners and how they're presenting the data, what they found their community responds to, and how we can improve our dashboards to make them more clear and to make it so that the public can not only access them, but can really easily use the data to protect themselves and others. So that's a little bit how our public dashboards work and how we share the data visually. But then when it comes to sort of written or verbal communications, we always try to work with our jurisdictions to give them up-to-date information about the pathogens we're testing for. So if it's something like influenza, then we'll try to keep that up to date with home programs here on, considerations about vaccination and what might be circulating. Then for more emerging things like measles, then we'll try to give them really timely information on next steps if you get a detection or how you can outreach in your community. So that's a bit how we share written. And then verbally, we know that some of our jurisdictions will have radio programs, which can be really effective, especially with communities that depend on that as sort of a way of getting word around. And then things like podcasts, which I'm really excited to be part of this one today. So I am glad to answer any questions on that, but I'll pass it to others too.
We really appreciate you being here too, Rachel. And yeah. Rochelle, how has that been used on a local level? Again, some of the data that you guys are collecting from MSD. Can you share a little bit about how that's, being disseminated out to the public and being used by different groups around Louisville?
Thank you for asking. What comes to mind especially is two different Louisville case studies. The first was during the COVID-19 pandemic. We sought to use wastewater concentration trends to deliver a geo-targeted digital health advertising intervention in Louisville. We assessed the risk of infection through the community through an integrated public health and wastewater rubric, and we delivered advertisements to promote COVID-19 testing and vaccination between November of 2021 and April of 2022. These advertisements were in 3 high-risk zones of the community. Specifically, they said things like, you're at higher risk for COVID-19 based on sewage monitoring in your area. And we saw really good click-through rates in these advertisements. So the results show the potential for digital public health interventions that are geographically anchored to sub-city sewer sheds and community interest and willingness to engage with targeted wastewater-themed public health messaging. And the second is the evidence of a practical use of wastewater data that has been developed in close collaboration with Jefferson County Public Schools, where the University of Louisville has helped develop a predictive model using community-level wastewater influenza concentration to forecast school attendance. We utilized seasonal influenza concentrations from a sewer shed area that included 51 elementary, middle, and high schools. These data were compared with daily school-level attendance records provided by JCPS for the academic years of 2022 to 2025. In addition to wastewater concentration, the models incorporated environmental variables such as rainfall and maximum temperature. Currently, JCPS is piloting this school attendance model with select schools during the 2025 to 2026 school season. For this pilot, potential action protocols from high wastewater concentrations may include advance notice to school administrators for staff planning and targeted school messaging on disease prevention measures such as hand washing and symptom recognition. Given the 2-week model timeframe, we're looking for short-term, less than 14-day public health actions to be emphasized.
How often do you guys report out to the public health and other stakeholders there in that area?
We report every week. Samples are pulled on Tuesday and Wednesday, and they receive a PDF as a simple report in their inbox every Friday.
Okay. So very, very real-time data and response on that. Scott, I know you guys also have been working with, I think it was with Case Western University and doing some other, applications within the community as well.
Right, yes. At the same time we were providing the samples to the state network, Case Western Reserve University, through the Cleveland Department of Public Health, reached out to us to see if we could partner with them on some research that they wanted to do as well. So we also started providing them samples of our plant wastewater influent for testing. And they were doing the qPCR, but they were also going through the whole genomic sequencing and looking at the variants and the change variants, the different variants of the SARS-CoV-2. But they also wanted us to do some more upstream targeted sampling. And when I say targeted, not of an individual home or anything like that, but more of congregate living areas where we had high density population. And they wanted to sample the wastewater coming out of those and see how the concentrations were changing over time as we progressed through the pandemic. And they also had some analysis looking at the actual geolocations of the clinical cases as people were coming in and getting tested. Each test result was tied to an address and a location, and those were being plotted on a map. Then they were looking at, the concentrations or the density of illness throughout the city. And they were seeing a section of the city that had literally no one getting tested and no cases of COVID in an area. And no one really believed that there was no COVID present there, but there was no one getting tested. So we were able to get into those neighborhoods and do some sewer sampling in those neighborhoods and confirm that, there was the same concentration of COVID there that we were seeing in other areas. We were able to use that information to inform public health that we had a section of the population that may not be well served when it comes to testing locations and information. So they were able to target some pop-up testing locations and get information into those communities so that those populations that weren't showing up in the heat maps of where we were seeing COVID could have testing available to them. They had, the disease and transmission of the disease just like everywhere else in the city.
I mean, it's amazing just how, again, practical, but obviously, like you mentioned, it's not, specific to specific people, but to those, areas and larger populations and helping to really target some of those responses. That's great that you guys were able to partner with them and help with that. Zanetta, I know you guys have, again, also used it just within MSD too, to use that kind of information to help with some internal decisions as well. Do you want to share a little more about how you guys have used that data and information for making decisions?
Yes, Jamie. It helped our executive director and our leadership team develop our policies on vaccination for employees as well as our vendors that had to interact with our staff. Also, it framed our decisions about which employees were required to work from at home, what the protocol while they were in our facilities, and how many could be even in the same office space. It helped us set up a tracking sheet on how many employees could be in the same, even the same work vehicle. It was critical because we had to have enough employees to run our critical services of wastewater treatment and our flood protection. Early on in the pandemic, we had like a whole shift of operators that could not come in, our maintenance staff. And so that was very, very critical for us to be able to make sure that we could mitigate those. And throughout the pandemic, it allowed Mr. Parrott, he convened meetings with our leadership team to fully understand the impact to operations and management and ensure that none of our services were not disrupted. He provided that leadership, for our agency, again, by, establishing those telework protocols, safety and PPE for our staff. And he used that to communicate your recordings for our entire organization. In fact, we were such a leadership in regards to that and using that data. He was selected in 2022 as one of the most admired CEOs selected by Louisville's Business First based on these practices and how we were using that data internally.
Again, really practical applications and helping to make those decisions. So that's great that you had that information to be able to make those decisions. You were able to use that effectively too. There's been other applications as well. And Jennings, I thought maybe you could share a little bit more about, how other groups are using wastewater surveillance data around the country and other locations that you've been working with.
Sure. So BioBot has essentially put together a program very similar to that which CDC has put together. It's called the BioBot Network. It's got about 150 different locations around the country that are submitting samples to us on a weekly basis for analysis on the presence of about 50 different substances, diseases, things of interest to public health. And so recently we've actually just entered into an agreement with the Office of National Drug Control Policy to give them a nationwide look at the presence of things like opioids, fentanyl, xylazine, a whole host of different drugs of abuse within wastewater. It's really informing public health decision-making at the highest level when it comes to the overdose epidemic in the United States. We've partnered with a number of different entities around the country to push this data into the hands of decision makers. It's helped local public health better target naloxone distribution points, helped different areas set up pill drop box locations where it might reduce the presence of unwanted or unused prescription opioids. So we're really proud of the work that we've done to lessen the impact of the opioid epidemic and hope that this can be kind of a model for public health usage of wastewater surveillance in the future.
Have there been any kind of unexpected findings that you guys have experienced?
Yeah, so, in the kind of high-risk substance realm, that's what we call these kind of collections, we were the first entity to discover the kind of spread of xylazine as an additive to the kind of growing opioid epidemic. It was one thing that we were seeing a lot of in a lot of different West Coast cities, and we kind of tracked the spread of it to some of the East Coast cities as well. So from a high-risk substance standpoint, that was very interesting to both us and our public health partners. From an infectious disease standpoint, right, we see new spikes of new diseases on a regular basis. Obviously, measles has become a large concern in the public health realm, and it's one of the diseases that we provide information on a regular basis for decision makers to see where it might be spreading next, if their community needs to do more in the public health realm to fight the spread of measles in their communities.
That's fascinating that you're able to track that and be able to see that and be able to see that across the country too. Scott, what have been some of the benefits that you've been able to realize for your region or for some of your customers in Northeast Ohio?
Well, I think it's a benefit to be able to get information for such a large population as quickly as we can. And this data can be used, as an early warning system. So individuals start shedding the viral RNA in terms of SARS-CoV-2 3-4 days before becoming symptomatic. And so you start to get a picture of what's happening in the community before, disease outbreak or before things start to spike. It's just useful information for public health. And that's evolved into all of these other pathogens now. So it's not just about COVID anymore, but it's, when is the spike in influenza A going to happen? And we can start to see it, coming before it, maybe fully gets here. Influenza B, monkeypox, the bird flu, all of the, RSV, all of the different applications. They're looking at, rotavirus, norovirus, looking for opportunities, to use wastewater for all of that. So the real gain here was that we got put into this situation with the pandemic where, we didn't really know what to do. And so we started trying to do anything we could. And now we've evolved and it's given us opportunities to use this science to better inform the public and to be ready for things. We might not have a significant outbreak of monkeypox, but as I understand it, you don't have to have a whole lot of cases and it'll show up in the wastewater. And if it appears, that's something to really, for that community to start focusing on.
Isn't that, are there other, you talked about obviously the benefits for making decisions that Mr. Parrott was able to do, but what other benefits have you guys been able to realize at MSD?
Well, I think that we have still use it ongoing, been able to track and warn our staff because, like you said, you can look at the national trends and just around you, and you typically know that during holidays and vacations that's going to happen, and so we could see that ahead of time. So we use it to just remind our staff about, large gatherings. You're giving them the empirical data. We know this, but they actually are seeing the data and what's trending. We also just enjoy being a conduit and helping with public health monitoring. And as we know, it's just, just to reiterate what the other panelists have said, it's a cost-effective way to monitor and helps us to reassure our staff, like we've seen outbreaks in other states, and what allows us to assure us that through this wastewater surveillance that we don't have any issues in our communities for certain things. So that's where we find the value, just to keep our staff continually informed and to provide them reminders, empirical data to remind them of what's coming ahead or what's present in our area, and as well as other areas of the country that they're traveling.
Rachel, I mean, nationally, I mean, what other benefits have you seen? And maybe a follow-up question to that too is just, where do you see this data being used in the future? I mean, how do you see that starting to evolve?
So nationally, we see many of the same benefits that are seen at the local levels. But one of the fun things about wastewater surveillance, at least I'm a microbiologist by training, so my fun is not everyone's fun. But for me, it's fun to explore all of the different pathogens that can be considered in wastewater surveillance. And so a benefit of this system is because of the dedicated and tireless work of our utility operator colleagues for the past several years, states and local health departments and tribes and territorial health departments have built up these networks so that there is a strong network to get these timely samples. And then this matrix is so flexible that we can look for multiple different types of pathogens, and some that, like Jennings mentioned, we didn't necessarily think we would be looking for, but they've been really valuable for public health. And so nationally, some of the benefits we've seen is that this is a flexible surveillance system. It provides complementary data to other surveillance systems. So we don't like to work alone. We like to work with other home programs to understand this is what we're seeing in the wastewater, but what are you seeing clinically? Is this matching up? Are we seeing a lead time? And it's different for every pathogen. So each pathogen is a new opportunity to learn about, okay, how does wastewater surveillance work here? How do we need to present it for folks to understand it and to be able to use it? One thing that I've learned, particularly from our jurisdiction colleagues, is that before you implement or before you start testing for a new pathogen, think about how you'll be using those data. Think about what that action will be. What's that public health value? And also think about what are the ethical considerations you need to consider around that? How can you make the data as high quality and timely as they can be? For us, some of the benefits we've seen too from our jurisdictional partners is that early warning, which can inform our CDC responses. So right now we have the measles response, and we recently had two publications from our health department partners in Oregon and Colorado showing a really early warning of measles in wastewater. So in Oregon, they did a retrospective analysis, but they found that wastewater signals preceded clinical cases by about 10 weeks last year. And we've seen now in the current response and in this year even that wastewater signals can give that early warning, not only to individuals who might look at the wastewater data and then think about different ways they might protect themselves and their loved ones, but also to clinicians who might be visiting with people who are coming in and making them aware that, hey, this is in your community or it's in a neighboring community. Maybe talk about it with some of your patients or in your clinics with your practitioners. So to your second question about where the future of wastewater surveillance is, we are really appreciative of this network that has grown because of utilities and the health department partners and lab partners and academic and private partners, and using that network and flexible matrix of wastewater itself so that we can look at sort of core pathogens that we either see pretty usually, like respiratory viruses. We know they have seasons, but also more emerging threats and things that might be vaccine preventable diseases, or that might be something that's new to a community, even if it's not a completely new virus or bacteria. And then essentially integrating those wastewater data with other surveillance systems. So continuing to kind of grow the portfolio of what we can share, what we can act on, and how we can help every community protect themselves and prevent the spread of disease further. I think in the future, just continuing to innovate, continuing to include things that we've learned from local health departments, but also experts in ethics, and continuing to grow the system.
It's amazing. You think about the different industries and backgrounds of the networks working together to be able to produce some of the results and outcomes from this is really cool to hear. I want to, I know at the beginning, Zanetta mentioned about some of the work WEF is doing with South Korea around this too, and just wanted to give a little bit more, or hear a little bit more about kind of if this is being done in other countries and how internationally they're looking at wastewater surveillance and how that's being used, or if that's being used. But Rochelle, do you want to, I know you've, not just have, experience here in Louisville, but also in other parts of the world too. But can you share a little bit more about how that's being done, what's being done internationally?
Yes, and I'd like to emphasize the great work that MSD is doing and the value it brings to the health of our community by supporting wastewater surveillance for public health. At the same time, it's important to remember that this work is happening not just locally in Louisville, but nationally, as we heard from Rachel on the CDC, and also globally. So I'd like to take a moment to share a bit of the broader perspective. So the wastewater surveillance we've been talking about on the podcast so far here in Louisville relies on samples collected from a piped sewer system. But many rural areas in the United States and many communities around the world don't have piped sewer systems. Instead, they may rely on non-sewered sanitation systems such as a shared outhouse or septic tank. And even in those settings, wastewater surveillance is still possible. The work here in Louisville focuses on SARS-CoV-2, flu, and RSV. Global programs might focus on different public health priorities, things like cholera, mpox, or even biomarkers related to nutrition. One global example I really enjoy sharing is that of a youth science camp in the East African country of Malawi, focused on wastewater surveillance science and wastewater utility careers. About 250 elementary school students participated last year, learning about environmental health, wastewater surveillance, and the many opportunities that exist in the wastewater workforce field. So what I see is that wastewater surveillance has the potential to bring communities together globally. The science is flexible and it can be adapted to the specific health priorities of each community. As the field continues to grow, I really hope we continue building these global connections and sharing best practices across regions, such as through the Water Environment Federation Communities of Practice, which I am part of. Global COPs can help bring together high-income countries and low- and middle-income country wastewater colleagues to address shared wastewater surveillance challenges, while regional COPs allow peer exchange experiences that strengthen wastewater surveillance programs, accelerate new advances, and improve response efforts.
That's great. Thank you, Rochelle. And just amazing to see how that's being used, like you said, in non-sewered areas, and rural areas as well as in other countries as well. Maybe just to kind of start wrapping up, where, and you all have kind of touched on some of these things again. Obviously, the surveillance programs have changed a lot just within even the last 5 years. But what are some of the key ways that you've seen it change? And maybe adding on to what Rachel said earlier about where you see this going in the future. But are there some key things that you would like to see continue to happen, and some of the key things you've seen changed over the last few years?
I'm very excited about some of the WEF communities of practice, how it brings together interested colleagues in an informal environment where you can share and learn together on a regular basis. And we didn't have those when we started the COVID-19 pandemic sampling, but now there's many different COPs. And so just encouraging that change for the future, I think is possible. And the growth will depend on those COPs.
Other thoughts?
Yeah, I'm just frankly thrilled that wastewater surveillance has become a mainstream public health data source. Obviously, coming at this from BioBot's perspective, we as a company were built to do this, and I see the future of wastewater surveillance as very bright. The number of things that we can detect in wastewaters near infinite, and so the more that it becomes a part of regular public health life, the more information the public health leaders will have all across the country to make these decisions. And I'm really excited to see things like in situ analysis or non-targeted assays that might detect things that we aren't even looking for. So I think the future of wastewater surveillance is bright and is evidenced by the group of people on this call today.
Yeah, thanks, Jennings. Definitely agree with you on that for sure. Scott, any other ways you've seen it change or which you're kind of seeing the future for you?
Well, we've already talked about the the vast number of pathogens that can be found in wastewater and how that can differ due to community, state to state, country to country. So it's just really interesting to see where it's going to go. But anything with, a genetic signature or a chemical signature that could be in wastewater can be tested for. And there's many different, things that we can learn from that. We were involved in a narcotics study that was described to me as looking at the chemical signature of fentanyl, and they were able to determine if the fentanyl that they see is related to pharmaceutical grade or non-pharmaceutical grade. And if it was non-pharmaceutical grade, it was described to me as that they could actually match it to the signature of a cartel. And so then you can see drug pathways and where things are coming from. And so you can use information like that to try and, target, drug enforcement and trying to, keep that material from entering the country if you know the pathways and things of that. So it just seems like the sky's the limit and that the science is evolving, and it provides us a lot of different opportunities to protect public health.
Yeah, that's fascinating, Scott. Thanks for sharing that. Rachel, any closing thoughts or to add on to what you shared earlier?
One of the things that maybe has changed nationally since the beginning of the National Wastewater Surveillance Program is, as Scott mentioned, as Jennings mentioned, sort of the sky's the limit of what you can detect. But one of the interesting things is also thinking about when wastewater surveillance maybe isn't the right solution, and thinking about how we define what we look for in wastewater surveillance. So scientifically, what's feasible, what is shed, and what we can detect reliably. But then there's also considerations of how will the community use it, and ethical priorities around, should we test for this? What does it mean for public health? Is this really something that we can use for public health value? And I think exploring that with each community is another really exciting part of wastewater surveillance. It's not only cutting edge science, but it's also interacting with each community and finding what's the right fit for them, how they'll use the data, and any innovations they've developed, whether it's a sampling method or a testing method that is applicable in remote or rural areas. It's just a really exciting field to explore, and then also think about how we can strengthen it and protect communities in multiple different ways.
Well, I got to say, I've learned so much from all of you just in this short discussion, and just so appreciative of everything you've shared. Just, it's really amazing to see, again, just how practical the use of this data has been, not just during the pandemic, but since then too, and just looking and being able to help direct resources within communities and helping to make decisions both within utilities as well as nationally. And just, I think the other key takeaway, just how, people from different backgrounds, whether you're in the water industry, you're in public health, whether you're in data science or technology, all of us kind of working together to really help tackle some of these hard questions and hard decisions, but using data to be able to drive those home. So very, very fascinating. And again, just thank you all for, sharing some time and having this discussion with us today. With that, Zanetta, I want to turn it over to you to wrap this up.
Well, thank you, Jamie. And I just want to thank each of our panelists for taking the time to be with us today. We could not have picked a better group of experts to share your expertise. And again, this is just allow us to understand the value of collaboration between the private sector, the utilities, public health, and government, and keeping going forward with innovative and research ideas to keep going to protect public health. One thing that we can tell that has helped these programs lately is utilities are less risk adverse to getting started. I believe probably Jennings could probably attest that at the beginning of this, some utilities were reluctant to get into the program. And hopefully by having these conversations, these crucial conversations, that we can continue to expand so that our ratepayers understand the great work and expertise that we have to assist in continuing to protect our customers and all the public, not just in the U.S., and help with global perspective as well. So again, I just want to thank everyone for being here with us today. And we're always available to you, and we'll continue to work together. Thank you so much for your time today.